Hello, you are watching News 9 Digital's Facebook Live with me, Amrita, and today we will be discussing about the disinfection tunnels which have become a norm amidst this coronavirus pandemic at various places, from office places to our market spaces as well. Now, in the latest, the central government, replying to a petition in the Supreme Court, has agreed that the disinfection tunnels are in fact harmful and they do not kill any sort of virus. To speak more about the disinfection tunnels, we also have allergist and immunologist Dr. Sitesh Roy from Mumbai with us. Dr. Roy, thank you for joining us on this live first of all.
Thank you, Amrita.
Dr. Roy, my first question to you is, how are these disinfection tunnels harmful to people, and in what way can they cause an adverse reaction in us?
So, Amrita, the first thing that's important to understand is that these disinfection tunnels were designed with the assumption that the virus is present on objects and surfaces and hence might be present on a person's clothes or bodily carrying objects. And what good research now in the past 6 months has shown us is that really the maximum source or reservoir of the virus is actually in the person's respiratory system, in their nose, sinuses, mouth, throat, lungs, and not really on objects or clothes. These tunnels basically provide a way for a disinfectant substance. The most common one being used is sodium hypochlorite or bleach.
Yes.
Or something called chlorine dioxide to be sprayed in a very fine mist onto a person. Now this creates a problem because these substances, besides being disinfectant, are also irritating to the lining of the eyes, the nose, the mouth, and also the skin. And in doing so, it can actually create reactions for people who have sensitivities or allergies or have asthma or have allergies or sensitivity, and these can really create a problem for people even healthy otherwise in causing reactions.
Yes.
And it is these kind of concerns and also the fact that there is no clinical proof to show that a disinfectant actually reduces the incidence of transmission of the virus, the reason why I believe the Supreme Court has taken the decision that it has.
All right. Also, Dr. Roy, there are certain types of disinfectants. There are chemical disinfectants, and then there are also some tunnels which are marketed as organic disinfectants, which are supposedly safer for use. So what would you talk about, the chemical and the organic disinfectants, keeping in mind that no clinical trials or no proof is available in either of the cases?
Correct. So as you rightly pointed out, Amrita, the proof is where surfaces, hard objects, have been cleaned with sodium hypochlorite, bleach, chlorine dioxide, silver ions have also been used. But there is no proof that if you spray it onto a person's skin or clothing, because the clothes can have holes, there can be areas that are hidden where the spray does not reach.
Yes.
So there is absolutely no clinical proof to suggest that, and we know that they can be irritating to the respiratory tract, to the eyes, skin. With the organic disinfectants, there is another issue that many of them have not been even adequately tested on surfaces. I had a patient the other day that brought me an organic disinfectant that was containing vinegar and certain fruit oil extracts or herbal oils. And when I did a research to find out if these had actually been tested against old coronaviruses or for influenza virus, I found that there wasn't enough data and there was no clarity on the concentration in which these oils or these substances were being used. People have also used glycerin they've used certain citrus oils, but this is really all experimental and anecdotal information.
Yes. All right. Thank you. Thank you so much, Dr. Roy, for speaking to us and sharing your insights with us on this very important topic, because it has become a norm almost at all of the places that we visit to have a disinfection tunnel, and people feel that they are safer, they are virus free, they are more cleaner if they go through these tunnels. And other than even those tunnels, we also have those sprays, those fumigation bottles where even people are being sprayed with the chemicals. Even in some salons, some hairdressing salons as well, people are using these kinds of method without having any scientific proof or evidence to back up these claims that these are actually safe. Now, the Supreme Court has also rightly asked the center about why are they coming forth with the answer to a petition now. And there is one more very important question that arises out of all of this, out of the center's response to the petition itself about disinfection tunnels, about why the center did not ban such kind of marketing, such kind of tunnels in the beginning of the pandemic itself, rather than coming out now in the open and replying to this petition. Keep in mind that these tunnels do not have a scientific proof of actually working. They might have a physical as well as psychological side effects, and the long-term effects of using these tunnels regularly will only be known after a certain amount of time. You can leave your opinion in the comment section down below. Also like, share and subscribe to News 9 Digital. Thank you.